Hi everyone, welcome to the Beveridge Museum of Health History. Today you'll be walking through 7 galleries and learning all about the Beveridge healthcare system. My name is Hazel, and the first gallery we are in will review the history of the Beveridge model. We'll begin our timeline with what the UK used before the Beveridge model was established in 1948. In the 19th century, hospital services were provided by a combination of private voluntary hospitals, tax-supported public hospitals, and cottage hospitals, an example of which can be seen in the first image. Hospitals were established to provide medical care for sick, poor people. The wealthier classes were generally attended to at home by their physicians. Initially, care was provided free, but financial constraints led hospitals to asking for patients to voluntarily pay what they could out of pocket. Starting in 1906, David Lloyd George, shown in the second image, introduced his first liberal welfare reform. This established government payment for health services in the UK. He also established the National Health Insurance Act in 1911. This provided payment for workers' medical care, funded by employee, employer, and government contributions. These reforms covered payment for general healthcare services and drugs. However, hospital services were still provided by public and private hospitals. During World War II, the UK suffered thousands of casualties to its citizens as they faced bombings in their cities throughout the war effort. These tragedies highlighted the inequality in healthcare access. In 1942, William Beveridge penned the Social Insurance and Allied Services Report, widely known as the Beveridge Report. This report from William Beveridge encouraged action to create a universal healthcare system. After the Beveridge Report was published, the National Health Service System of the United Kingdom was established by an Act of Parliament, the UK's answer to William Beveridge's report demanding universal healthcare for all the country's citizens. The NHS was officially born on July 5th in 1948, after years of research by the government. The NHS nationalized the hospital system, payment for care by the government, and universal coverage for all UK residents. The NHS is based on 3 core principles: that it meets the needs of everyone, be free at the point of delivery, and be based on clinical need. In 2011, the Department of Health in the UK published the NHS Constitution, which highlights the 7 key principles that guide the NHS in everything it does and outlines the responsibilities of the NHS to the public. Up until now, a large number of trusts managed and provided care in England, and commissioning was done under the primary care trusts and other specialized commission groups. However, in 2013, Parliament passed the Health and Social Care Act, which changed the commissioning trusts to foundation trusts and NHS trusts. This was done in an effort to change commissioning from a government body to clinicians, increase patient involvement, and renew focus on the importance of public health, amongst other goals. Next in our tour, I'll be presenting 8 historical objects that represent major events that have occurred in UK healthcare. Our first item is an image of the Stanmore Cottage Hospital. Stanmore Cottage Hospital was constructed in 1890 by 2 local residents, Emily and Catherine Wickens. Cottage hospitals were located in small rural communities and were convenient due to their close location to homes and medical staff in the area. These hospitals were common before the NHS, and provided health care for those people who could not afford to pay for healthcare services out of pocket. As of 1980, the Stanmore Cottage was closed as a hospital. Throughout those 90 years, it served as an isolation hospital, emergency hospital, and children's home. In 1997, it became the first residential care home for children with learning disabilities. Next, we have a flyer for the citizens of the UK about the National Health Insurance Act from 1911. The National Health Insurance Act of 1911 was the first time that the UK government helped to pay for health care for its citizens. This leaflet promoted the National Insurance Act to the citizens. With this system, employees were required to pay weekly along with their employer. The act allowed workers to take sick leave and still be paid at a lower rate. They also received free treatment for tuberculosis and also provided maternity benefits. The act also provided health care for people who were unemployed for a limited time. These unemployed people would receive funds for 15 weeks a year. This was primarily for highly cyclical industries such as building trades or vehicle manufacturing. In London in 1928, penicillin was invented. The image on the far left is a picture of Alexander Fleming, the inventor of penicillin. Penicillin is a class of antibiotics that destroys bacteria in the human body. The invention of penicillin was the first medication that could treat infections, such as pneumonia or rheumatic fever. Before the invention of penicillin, patients who got infections only had hope that they would survive. In 1941, penicillin was turned into a life-saving drug at Oxford University by Howard Florey and Ernst Chain. The first recipient was a 43-year-old policeman who had contracted a deadly infection. Within days of receiving the medication, he had made a full recovery. Wartime conditions made development difficult, but a London company, Pfizer, took up the challenge. The next historical object is a flyer that explains the Beveridge Report to the citizens of the UK. The Social Insurance and Allied Services Report, also called the Beveridge Report, was written by William Beveridge in 1942. The report explains that there are 5 great evils on the road to Reconstruction: want, disease, ignorance, squalor, and idleness. Beveridge set the report out to be just the first steps towards social progress, to be a society free of these evils. The report described impoverished life in the UK. He recommended a flat rate universal contribution in exchange for a flat rate universal benefit. The British Institute for Public Opinion conducted a nationwide survey about the Beveridge Report and found that 95% of the population had heard about it, and the majority of the population approved its recommendations. Next, on our far left, we have an NHS welcome pamphlet. As Britain was the first Western country to offer free at the point of use medical care to the entire population, explanations were necessary about the upcoming changes. The Minister of Health at the time stated, "No society can legitimately call itself civilized if a sick person is denied medical aid because of lack of means." By the day that the NHS went into effect, 3/4 of the population had registered with the NHS. The NHS welcome pamphlet, shown, includes a diagram explaining what is included with this new health system. In big, bold font in the center of the flyer, it tells citizens to choose your doctor now. In the center of our display, we are looking at an image of the first modern hospice center created. The first modern hospice center founded was St. Christopher's. It was founded in 1967 by Dame Cicely Saunders. Miss Saunders realized that hospital doctors tended to abandon their dying patients in the 1950s. She took inspiration from medieval hospices that cared for ill travelers to create a more modern hospice facility that cared for its patients and kept them comfortable. She combined caring attitudes with cutting-edge medical research and teaching. By changing healthcare attitudes from finding a cure to providing care, her staff was able to provide patients pain and symptom management, along with care and companionship. She called this total pain, which is now a term recognized by hospice professionals around the world. We'll finish the gallery with the last 2 historical objects. On the far left, you see the inventor of in vitro fertilization. British scientist Robert Edwards successfully invented in vitro fertilization in 1969. He began his research into IVF in the 1950s, when he realized this possible treatment for infertility. However, he had to recruit help from Dr. Patrick Steptoe to help with the removal process. The first egg to develop into an embryo occurred in 1978 thanks to both physicians. They established the Bourne Hall Clinic in Cambridge, which was the world's first center for IVF therapy. Doctors and biologists from all around the world trained at Bourne Hall, where methods were continuously refined. By 1986, 1,000 children had already been born following IVF treatment. And our last historical object is the NHS Constitution Handbook. The NHS Constitution Handbook covers the values and principles that guide the NHS, explanations of the rights and pledges in the NHS Constitution, legal sources of patient and staff rights, and the roles that all citizens play in protecting the NHS. The UK government published this handbook to give the public all the information they needed for the NHS Constitution of England. The NHS Constitution details 6 values: everyone counts, working together for patients, compassion, improving lives, respect and dignity, and commitment to quality of care. The handbook is updated every 3 years to ensure it remains up to date, and of continuing value to patients, staff, and the public. That brings us to the end of the first gallery. Thank you for your attention, and now I'll leave you to Gallery 2 with Beveridge.
Thank you, Hazel. Welcome to Gallery 2, the Biographies of Key Figures exhibit, where we'll discover and explore the lives of influential individuals who played a pivotal role in developing the Beveridge model. David Lloyd George became one of Britain's most impactful reformers in social policy. Known for his passionate drive for change, he entered Parliament in 1890 as a Liberal member, where his influence on social welfare quickly grew. As Chancellor of the Exchequer, he championed the 1911 National Insurance Act, a breakthrough in social protection that introduced health and unemployment insurance to shield workers from poverty. This act's funding model, supported by workers, employers, and the government, set a new direction toward universal welfare. Beyond social insurance, Lloyd George also targeted education and labor reform. His 1918 Education Act raised the school leaving age and restricted child labor, providing stronger safeguards for young people. During World War I, he served as Prime Minister, leading the nation's war efforts and later signing the Treaty of Versailles, promoting international peace through the League of Nations. While his career was not without controversy, Lloyd George's lasting contributions shifted British policy from individual responsibility toward collective support. His reforms laid the foundation for the welfare state and influenced future models of universal healthcare and social justice, including the Beveridge model, which followed his legacy. William Beveridge was a key architect of the UK's modern healthcare and welfare systems. Born in India and educated in law, Beveridge was also deeply affected by the poverty he saw in East London, which drove him towards social reform. He collaborated closely with Prime Minister David Lloyd George, helping to establish early social insurance programs like the Labour Exchanges Act and the National Insurance Act, both essential in laying the groundwork for national healthcare policies. In 1942, Beveridge authored a groundbreaking report, Social Insurance and Allied Services, identifying 5 major social issues known as the 5 giant evils: want, disease, ignorance, squalor, and idleness, and urged the government to address these barriers to societal progress. His recommendations inspired the creation of the National Health Service in 1948, a system designed to provide equal healthcare access for all citizens. This framework became known as the Beveridge model, named after him to recognize his vision for a system where healthcare is a universal right, accessible to all regardless of income. His legacy in promoting social justice and universal healthcare remains influential worldwide, underscoring the importance of equality in access to health services. As Prime Minister from 1945 to 1951, Clement Attlee reshaped Britain's healthcare and welfare landscape. In 1948, his government established the National Health Service, or NHS, a pioneering healthcare system funded by taxes and available to all citizens at no cost at the point of use. This change ensured that financial constraints would no longer prevent access to medical care, making healthcare universally accessible in the UK. The foundation of Attlee's welfare state was laid with the 1946 National Health Service Act, which guaranteed comprehensive support from cradle to grave. This act introduced benefits for unemployment, illness, and old age, creating a safety net for those unable to work. Attlee's focus on universal services reflected his commitment to social justice, ensuring that essential care was a right for everyone, not a privilege for few. In addition to healthcare, Attlee's government passed critical legislation like the 1948 Children's Act, expanding protections for young people and further strengthening the welfare state. His reforms fundamentally shifted British policy towards collective responsibility and laid the groundwork for public services as rights for all citizens. Attlee's vision continues to influence healthcare systems globally, setting standards of access, quality, and equity that are core to modern public health values. Lastly, Aneurin or Nye Bevan, as Minister of Health under Prime Minister Clement Attlee, played a pivotal role in creating the NHS. Bevan's vision centered on universal access, ensuring that healthcare would be a right for all citizens regardless of income. He strongly believed in the social justice of this model, famously saying, No society can legitimately call itself civilized if a sick person is denied medical aid because of lack of means. Bevan faced intense resistance, particularly from the British Medical Association and other groups wary of government control in healthcare. Despite this, he successfully negotiated compromises, such as allowing hospital consultants to treat private patients, which helped bring the NHS into being in 1948. His dedication set a new standard, establishing healthcare as a public right and marking a shift towards a society that prioritized equal access to medical services. Although his efforts closely tied the NHS to the Labour Party, Bevan's reforms left an enduring legacy. His contributions have inspired numerous nations to consider healthcare as a universal right, and the principles of the NHS continue to influence discussions on healthcare equity around the world. Thank you for joining me in exploring the lives and contributions of these key figures who shaped the Beveridge model. I hope you found their stories as inspiring as I do. Now I'll pass you over to my colleague Megan, who will guide you through our next exhibit. Thank you again and enjoy your visit.
Thank you. Welcome to our next exhibit, where we will dive into the culture and ethnography related to the Beveridge model of healthcare founded in the United Kingdom. Our first artifact is a flyer announcing the beginning of the National Health Service. Next, we see a photograph of a medical ward in a UK hospital. Is anyone here a fan of Walt Disney's film Mary Poppins? If so, next, let's learn a bit about mental health's place in the Beveridge model. In this photograph, taken in 2021, you can see a... Now, we will explore the newest display in our culture and ethnography exhibit. This section showcases the connection and impacts between the population of immigrants to the UK from South Asian countries and the National Health Service. First, it is important to understand the population we are speaking of. Now, it is important to recognize that while emigration from South Asian, and since we mentioned cuisine, let's learn more about it. What you see here is a sphygmomanometer, otherwise known as a blood pressure. Finally, we round out our exhibit by discussing the importance of the care.
Hello, everyone, and thank you for joining us here to discuss Beveridge science and technology. Penicillin mass production. The discovery of penicillin antibiotic properties was discovered by Alexander Fleming in 1928. However, the mass production of penicillin antibiotic didn't take effect until the 1940s when Howard Florey and his team at Oxford University faced challenges of treating curable wounds, open wounds, infections sustained in battlefields of World War II. They knew that of the 10 million soldiers killed in World War I, about half died not from bombs, shrapnel, bullets, or gas, but rather from untreatable infections from often relatively minor wounds and injuries. The Oxford team purified and separated active components of mold, and in doing so, the team was able to decrease mortality rates by decreasing bacterial infections and rates of sepsis. Penicillin greatly influenced NHS treatment protocols by making it one of the first widely accessible treatments available. It emphasized preventative and curative approaches to bacterial infections. Advancements in medical imaging. During World War II, there was an increased need for medical imaging that was readily accessible. Although there were other scientists credited for the discovery of the X-ray, Dr. Archibald McIndoe facilitated its diagnostic capabilities on the battlefield. Post-war, the NHS adopted this technology to expand diagnostic access in rural and underserved areas. Portable X-rays continued to impact health outcomes by enabling timely diagnosis, especially in emergency and remote settings. Dr. Peter Mansfield was an English physicist who, in conjunction with Paul Lauterbach, was awarded the 2003 Nobel Prize for Physiology or Medicine for the development of MRI technology that uses selective absorption of very high frequency radio waves by certain atomic nuclei to characterize liquids and solids. MRI technology provides detailed images of internal structures, improving diagnostic accuracy and enabling early detection of diseases like cancer. Advances in public health and epidemiology, vaccine campaigns, and bacteriology. Advances in vaccine science were rolled out in public health campaigns addressing infectious diseases in alignment with the establishment of the NHS. In 1940, diphtheria became the first vaccine to be offered free to children on a national scale. Diphtheria, from Corynebacterium diphtheriae, is bacteria that spreads via respiratory droplets. Bacteria releases a toxin that targets nerves to the throat, lungs, heart, and extremities, causing paralysis. It also creates a characteristic gray membrane that kills through obstructing airways. Before the introduction of the vaccine in 1942, the UK experienced an average of 55,000 diphtheria cases annually, resulting in approximately 3,500 deaths per year, predominantly among children. Vaccination campaigns reduced the rates of diphtheria. Minister of Health Aneurin Bevan, in a speech to the Council of Education and World Citizenship, cited immunizations as an example of what centrally coordinated health services backed by modern science could achieve. DNA structure discovery. In 1953, scientists James Watson and Francis Crick, working at Cavendish Laboratories in Cambridge, along with X-ray crystallography work by Rosalind Franklin at King's College, developed a three-dimensional double helix structure of DNA, which led to the winning of the Nobel Prize in 1962. With this modeling, they were able to characterize how genetic information is passed through the unzipping of the double helix and copying through an RNA primer and resynthesis of DNA. Now, as a molecular biologist, this discovery created a huge impact. This groundbreaking discovery paved the way for modern genetics, allowing for advancements in genetic research, disease understanding, and biotechnological applications. The World Wide Web. Tim Berners-Lee, a British scientist, invented the World Wide Web in 1989 while working at CERN. The web was originally conceived and developed to meet the demand for automated information sharing between scientists and universities and institutes around the world. The first website at CERN and in the world was dedicated to the World Wide Web project itself and was hosted on Berners-Lee's NeXT computer. On April 30th, 1993, CERN put the World Wide Web software in the public domain, and he won the Millennium Technology Prize for outstanding technological achievements that directly promote people's quality of life, are based on humane values, and encourage sustainable economic development. The World Wide Web enhanced communication and collaboration amongst healthcare providers. It increased access to medical research and data. It enabled online prescription services and digital records. And finally, the World Wide Web caused the expansion of public health initiatives. Introduction of new healthcare products and services and its impact on health outcomes in the National Health Services. The new healthcare products and services mentioned previously had created impact on health outcomes, but also helped shape the National Health Services into the system it is today. Diphtheria vaccine campaign affected health outcomes with an impactful reduction of mortality and morbidity of infectious childhood disease that caused the death of at least 3,500 children per year in the UK alone. However, the campaign not only caused public awareness of the importance of immunization, but it also laid the groundwork and foundation for other vaccinations to include measles, mumps, rubella, tetanus, pertussis, and polio. Most importantly, these initiatives inspired trust in the government healthcare system. Penicillin revolutionized the treatment of infectious diseases. Prior to the 20th century, the average life expectancy was 47 years of age. Post-antibiotic era, the average life expectancy was estimated to be about 78.8 years of age. The percentage of older population rose from 4% to 13% of the entire U.S. population. The impact it had on the National Health Services was that it created the foundation of National Health Care Service pharmaceutical services, an organized system to distribute medicines and in effect increase access to all citizens no matter what their income. Additionally, it also caused public awareness and the importance of antibiotic stewardship. With the bacterial infections readily treatable, the NHS could shift its focus from acute care to more preventative care. Advancement of medical imaging. It goes without saying that the impact on medical imaging like X-ray and MRI on health outcomes was expansive. Gone are the days of the countless exploratory laparotomies where imaging could enable diagnoses non-invasively, reducing post-operative infections. It also led to the earlier diagnoses of conditions like cancer with greater accuracy and speed. As the axiom goes, time is tissue. The impact it had on the National Health Service was that it led to the development of specialized services in the NHS housing, specialized radiology, interventional radiology, and diagnostic departments for modern medicine. It led to a spirit of innovation in the NHS, thus gaining public trust in the government system. These advancements created a solid scientific and technological foundation that not only benefited the war effort, but also played a pivotal role in shaping healthcare infrastructure and public services in the UK during the Beveridge period and beyond. Key stakeholders and perspectives. The British government and Ministry of Health. From their perspective, British political classes were committed to the social rights of a comprehensive welfare state based on the Beveridge Report. But at the same time, they came to expect behaviors in return. It became unacceptable for people to be unhealthy and their citizens would be under pressure from both peers and state to be healthy. It became the duty of a citizen to cooperate and participate in the immunization efforts, sanatoria, and health education efforts. Government imposed moral and legal conditions on citizens in return for their services. From the perspective of the British public and NHS patients, the public benefited from improved health outcomes, reduced mortality, and accessible infection treatment and prevention. In T.H. Marshall's book, Citizenship and Social Class and Other Essays, he states that the welfare state embodies and ensures social rights, including access to care, education, and social security. Protection from hardship became a right of the British public, and it became incumbent upon the government to use modern science and technology to attain it, even taking control of private industries in the name of accountability and efficiency.
Hi everyone. As you start walking through the hallway, you'll be entering Gallery 5, where we're going to have an interactive exhibit going over the Beveridge model payment structure. Hi everyone. So if you look to your right, there's a closet where we have our costumes for this interactive exhibit. So children, if you can please walk over and pick costumes of your choice. We have costumes to dress up as government authorities, providers, and even patients. As you're picking out your costumes, I am going to give a background on the Beveridge model payment structure to set the background. So the Beveridge model funds healthcare services through tax payments, according to the American Healthcare for All Advocacy Program 2021. The government is responsible for the quality of care and can even limit healthcare services according to the American Health Care for All Advocacy Program 2021. And healthcare is provided to everyone, regardless of utilization per person of how much healthcare services that they use, according to the American Healthcare for All Advocacy Program 2021. And so we have a photo here of a child dressed up. All right, is everyone dressed up? Okay, great. So I'm going to ask the providers and patients to match up, to come together. Okay, so for this piece, this will show the healthcare services that might be limited, such as for patients having to pay for items like wigs if they have cancer or leg braces, but they're still significantly subsidized according to International Citizens Insurance, ND. Now, private insurance can provide quicker healthcare services than public care. And screening and vaccinations do not receive or require copayments, according to Tikkanen et al. 2020. So patients, you can see the type of services that you can receive without copay and if there is a type of payment involved. And we have a photo here of someone with a brace on their leg. Don't forget your costume kit. And in this interactive exhibit, we're using fake money to show the cost of healthcare services that could be limited between patient and provider. Cover that. So thank you, provider and patients that were dressed up. You're good to go to your original spots. Now, government authorities that are dressed up, can you match up with providers? So here we're going to talk about how healthcare facilities receive payments from the government, according to the American Healthcare for All Advocacy Program 2021. The government acts like a single payer. And due to this model, there's little to no competition, according to the American Healthcare for All Advocacy Program 2021. And here we have a photo of money. And I wanted to thank you all for walking through this interactive exhibit, and I hope you learned about the payment structure for the Beveridge model. We'll be now moving down the hallway to Gallery 6, where I'll be your guide. Hi everyone. For Gallery 6, you're going to get to hear exclusively the curator's perspective of the health system. For health disparities, we have prisoners not receiving adequate care, according to Bachara 2023. They are receiving delayed health services, including cancer screenings, and many of their common symptoms are anxiety, depression, and personality disorder, according to Bachara 2023. So here we have a photo of a jail. For health disparities, there has been a limit in medical supplies to patients in the UK, and it has caused impacts to patients with diabetes, chest pain, heart failure, cancer, and even those who have epileptic seizures, according to BOFI 2024. According to BOFI 2024, there could be delays in treatment that can extend 2 months. And the current list of medical shortages are 96 products, according to BOFI. So we have a photo of pills or medicine to really bring up the importance of the impact of limited medical supplies and the health disparities that result from it. For safety net programs, there's an established safety net, which is a network of multiple NIHR patient safety research collaborations. It's focused on research to improve patient health outcomes and the health system in England, according to GM PSRC web team and Mahabubari 2024. And this year, there was a safety net webinar. It was focused on discussions around improvement towards diagnosis for patients, according to GMPSRC Web Team 2024. And then Pharmacy First Service was launched this year in January to help patients be referred to community pharmacy for minor sickness, according to NHS England ND. So we have a photo here of a healthcare professional surrounded by medication. For cost containment and quality improvement, there is a 2024 voluntary scheme for branded medicine pricing and access that stands for VPAG, provides the ability for the NHS to determine medicine pricing for quality of medication and keeping pricing low, according to the Association of the British Pharmaceutical Industry, ND. And the UK government published a consultation in March 2024 for statutory schemes related to medicine pricing to continue that path to keeping pricing low and providing quality of medication, combined with the VSAG. According to the Department of Health and Social Care 2024. And we have a photo here of medication. So with the health system influence, the Beveridge model focuses on women's health, assisting women who have had experienced trauma after birth, domestic violence, to assisting women with painful menstrual periods, according to the Department of Health and Social Care et al. 2024. And there has been political agreements on improving preventive and primary care services to reduce patients from being admitted to hospitals, according to WellKnow 2024. And an example is phasing out smoking, according to WellKnow 2024. So we have a photo here of a woman who has tears on her face. For health market shifts, patients are interested in wellness programs, even to where health insurances can provide discounts on gym memberships, according to Switch Health. So I have a photo here of a gym. Now, with health insurance coverage, patients are looking towards, and this is the shift, to having more personalized coverage to services that they need and services that are unnecessary, as well as receiving quicker service through private insurance, according to Switch Health. Now, according to Osborne Clark 2024, UK established Regulatory Innovation Office to support market entries. So there's a shift towards innovation and services, including digital healthcare services, to enter the market. Now, opportunities to improve in the future for the Beveridge model system in the UK is promoting wage increases or monetary incentives for providers to retain staff, according to WellKnow 2024. Also, increasing staffing to meet the population demands is very important, according to WellKnow 2024. There was a report by the Association of Directors of Adult Services identified last autumn 470,000 people waiting to be assessed and receive healthcare services in England, according to WellKnow 2024. And investing in healthcare technology to automate routine healthcare services is going to help to take off some of that load from providers' daily tasks, according to NHS England, NDA. Now, having also coordinated effort between the different departments in the local government is going to make a difference, according to the Health Foundation, where it will have an outcome of improving the health care of the population. So I want to thank everyone for walking through Gallery 6. You'll be now walking through Gallery 7 with Vicky. Thank you, everyone.
Welcome to the last gallery of the Beveridge Museum of Health System. We hope that you have enjoyed your time and that you have learned some interesting facts about the British National Health System, the NHS, which is a health model designed based on patient needs and not their ability to pay. In this last gallery, and before you conclude your visit, we would like to show you some items that you can take home as a souvenir or share with friends and family. The first item is a book called The Beveridge Report: Blueprint for the Welfare State. This is a book that provides the background and historical context on the creation of the British National Health System by William Beveridge. This book is a good read for anyone who is interested in gaining an in-depth analysis of the 1942 Beveridge Report and the social and political impact that it has created. The next item is a poster that outlines the construct of the public-funded British health system, the roles and responsibilities of the stakeholders, and the relationship between the NHS and providers. This is a good artifact to take home for anyone who is interested in getting a quick overview of this publicly funded and operated health system. The next item is a book called Vanguard's Model. This book talks about an innovative enhancement to the NHS that was introduced in 2015, the Vanguard model for care delivery and services. If you are looking to be inspired and want to envision the future of health system, this is a gift for you to take home. Another innovation of the NHS is the integrated care system introduced in 2013. It involves 25 pioneer integrated care sites across the UK aimed at improving patient outcomes and long-term care through community partnerships. This annual report provides updates to the program and is free to take home. So don't miss out on the opportunity to learn about innovation in the Beveridge health system. The last gift item is a t-shirt of Anilan Bevan, who is known as the father of the NHS. He was the British Minister of Health that turned William Beveridge's idea into reality. The t-shirt features a famous quote by him that says, "No society can legitimately call itself civilized if a sick person is denied medical aid because of lack of means," a notion that has remained the essence and the core of the British national health system. Thank you for being on this tour with us. We hope you will walk away with helpful information about this one payer, one provider health model with the focus on patient needs and not the financial means. We hope to see you again.